name is Eva Burns, and I'm a patient of Dr. Mazaheri. I've had a lot of dental problems in my life, probably starting in my early 20s to current. At some point later, I developed Sjogren's disease, where that was a big part of what my dental problems were. So how this started with this All-on-4 at the beginning of 2020, when COVID was kind of in full blown effect, then I was Googling online, different options for myself. And I saw this All-on-4 procedure, and I ended up and made, I think, 3 appointments for 3 different places, and I went into the first 2 and I got prices from them. And then I called Dr. Mazaheri's office, and my sister was with me. She, for many years, was a dental hygienist, and then she got into the oral and maxillofacial surgery with a really well-known doctor in California. And she just thought he was great, that Dr. Mazaheri was great. And so we talked money, and honestly, he wasn't the most expensive and he wasn't the cheapest. But I felt he was the most knowledgeable of any of the people that I had went and I had talked to. So after some more, searching my soul and debating about it, because it's a big expenditure, that you're putting out. I went ahead and I decided to do it. I've had it for probably a year, just about a year now. I have lived with a lot of pain for many, many years with my mouth and my teeth, and from extractions to cavities to, decay to, I think I had 17 crowns in my mouth, and none of them, except for one, were without issues. But as far as how it is now, I can't even describe the feeling that I get, that I can go to bed every night now for the rest of my life and never have to have another toothache, another cavity filled, another crown, another root canal. I mean, I've had failed root canals and redos done, and yeah, you do expend out some, but I mean, I just felt like over the course of time, I would end up spending that much, if not more, and have a lot of pain as well. I had went to other dentists for quotes and to meet them, and you have to feel comfortable with who you go to. And even in my life, all of my regular doctors, specialists, I've seen my same primary care doctor for 15 years. Same with most of my specialists that I see. And if I don't feel the comfort level right when I walk in the door, I won't be back. And I felt that immediate comfort level with him, and so did my sister, who's had a lot of experience in the dental field. So yes, I would recommend him highly. It was just a pleasure from start to finish. I really have no problem eating anything. I mean, I've ate ribs, I've had corn on the cob, all the things that you would think that, I don't know that you would do so well with if you had like a set of plate dentures that you take in and out every day. So for me, this was also the best bet too, because I just wanted something that was gonna feel the closest it could to my real teeth and look. I didn't want them to look like dentures either. I didn't want a big pink gum line, across the top or the bottom, where if someone looked at me, they'd say, oh, she's wearing dentures. And I feel like they look absolutely like my regular teeth, and white as white can be, and just amazing. And I've already been through the process of having them taken down, and it's just easy. It's just very easy. But no, I feel good with them. I feel like I can eat very, very good with these teeth. Feel real natural. I feel like I want to tell people, you know, don't just write it off. Don't just say, I have diabetes, I can't do it because I have diabetes. Or I have high blood pressure, or I have, you know, whatever. I'm not a doctor, but I had other health issues as well as the Sjogren's, and they worked right alongside other doctors. They made sure that I was taken care of, that, you know, that I was, you know, going to remain healthy, and that they didn't do anything that could possibly jeopardize me. And that is real, real important to me. So if you've got other things going on, please don't just write it off, because you know, unless it's really, really severe, I believe, and you know, you'd have to speak to them, but I believe this is something you could get done and you will end up loving for the rest of your life, because I do.